All right.
Pustules.
All right. 8 healthcare clinic workers were surveyed. Signs and symptoms of gonorrhea in a male. What does the discharge look like?
Milky, sloppy.
Thank you. 50 points. Milky discharge. Gonorrhea. Did she say? I didn't hear her. I heard the milk came over here first.
She said it right away.
All right, she gets 20 points. I didn't hear her. 20 points. She gets 50. She gets 20.
I heard it.
What if
She gets 20.
yes?
I got 50, she got 20.
1,000 of those healthcare workers, especially the nurses, they were told to give the newspaper this answer. The #1 treatment for syphilis is?
Penicillin G.
Thank you. They both answered at the same time. They both get 50 points. Penicillin G. All right, we're going to use the female reproductive system.
Whoop, whoop, whoop.
All right. Following a procedure, 25 females said that they all had this symptom.
Burning.
Following a laparoscopy of the pelvis.
Pain in the chest.
Cramping.
Gas in the stomach. Air.
Vag gas. All right? Vaginal gas. For 15 points for her, she asked. Who got it? I didn't hear you.
You didn't hear me?
Yeah. All right. All right, vaginal gas. For an extra bonus 5 points, can anybody tell me? Is normal?
Yes. Yes. Weeping.
Okay, 5 points.
Normal for him.
All right.
5 points for each team.
And did everybody answer that elderly person above age 50, you get a mammogram yearly? Everybody got that?
Yeah.
All right. Bonus. Bonus. For those of you who worked at Helen Ellis, you were both all surveyed by Miss Winsky. And this question came up. One of your patients has mastoiditis. She wanted to breastfeed. What is the #1 answer you're going to give that person that she has to do with her breast before she starts breastfeeding?
Warm cloth.
Almost?
Cool cloth.
No?
Stand in the shower.
No?
She wants to pump that up out and
Very good. So she has to do what to
Pump
it?
and dump.
pump and dump.
Very good. She has to empty the breast thoroughly. 50 points.
Thoroughly?
She said that the first before everybody.
She did say pump.
She just said pump, but she didn't say pump it, all of
It's
it.
cool.
You have to, all right, give them 10 points.
It's all great in this
All
round. It's all
right,
great.
very good. You must empty it for a bonus point of 25. Tell me why it has to be thoroughly emptied. What are you trying to do?
Get rid of the
Get rid of
infection.
it.
No, clear the lines.
Flush
Get
it.
fresh
Yeah,
milk.
you're supposed to
You're
clear the lines.
preventing what?
Oh, you're preventing it to go to the next season.
What's it called?
What's that word called?
And
When I give it to you, what's it called?
Acquired.
engorgement.
Oh, engorgement.
Okay.
Oh.
I thought,
10 points each.
That doesn't,
I, okay.
you're not emptying it for engorgement, you're
Moving
emptying.
along.
To prevent engorgement. Because if you don't empty it, it'll get bigger and bigger, more engorged. All right? All right, we're up to the males. We're up to the males. All right. For every 1,000 CNA, LPN, and RN was surveyed, the #1 answer when they were trying to get information from a male patient was this. They're having difficulty with what?
Urinating.
Thank you. #1 answer. 50 points.
Gotta get up.
The #1 urinating. #1 in assessment. #1 answer following a prostate surgery for 25 points. What type of exercise would you encourage the male? Thank you. 25 points
What did
goes
she
to
say?
him.
Kegel.
Kegel exercise. Kegel exercise, I'm
Why are we
doing.
giving it to him?
Ain't supposed to be jumping around.
Kegel,
You're just enjoying it.
Kegel exercise.
Yeah, you know that. Never, we told you that. What's the Kegel dance?
All right, for an extra 10 points. Why? For an extra
Strengthens their muscles.
to prevent,
Leakage and incontinence.
thank you, an extra 10
What
points.
did she say?
Incontinence.
Well, I believe we all said that at the same time. 1, 2, 3.
Who said it? You said
Me,
it?
Gabby,
All
and
right.
Teresa.
I only heard it over
It's because
here.
we kind of blend.
My
with
mouth gets bigger.
10 each, 10 each.
Oh,
We blend with you.
All right, you're training the bladder to prevent incontinence, so to lessen it. All right. So, what would you teach Daniel to do by himself every month?
Testicular checks. Check the testes. Check the balls.
Very good. TSEs. TSEs.
Feel them and like it.
TSEs. So while Daniel was doing TSEs, he developed epididymitis. Okay. So,
Swollen testes.
what would you encourage him to do with
Ice
those
them.
orchids? Ice them.
Elevate.
Right, rice them. 20 points each. You're
Have
gonna
your
put those.
wife
You're gonna put those flowers on a pillow and put ice on them.
And what did he have?
Epididymitis.
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 Have his wife ice them while caressing.
Epididymitis.
Said it 3
He
times.
put his flowers on a pillow and put ice on them.
Flowers?
Yes. His orchids.
All
That's
right.
what I wrote in my paper. Rice the orchids. Whatever, don't go with my spelling, there, it's epididymitis.
30 elderly females who are having stress incontinence at a bingo game because they were shouting and coughing, said they had to wear these all the time.
Pessaries.
Depends.
Thank you. Depends or panty liners.
Why did
30 points.
Stress incontinence.
Stress
I think
incontinence.
pessary.
Oh, I'm gonna be wearing them all next semester then.
All right. Renal nurses were surveyed.
Renal.
Renal.
Kidney.
Renal kidney nurses
Kidney.
surveyed. And these signs and symptoms of acute glomerulonephritis were part of their daily routine with acute glomerulonephritis. Fatigue, anorexia, increased BP. What were the nursing interventions for that patient with acute glomerulonephritis? The patient was fatigued, they weren't eating properly, they were anorexic, and their blood pressure was high.
Consult a dietitian.
What?
What
What was the intervention? To make sure the patient did what?
Urine.
Make sure the patient did
Stay
what?
hydrated.
No. They
Take
were
the
fatigued.
medication.
Thank you.
Blood
Make
pressure.
sure the patient rested. The patient needed rest, 50 points.
What?
For an extra 25 points, what color is the urine with acute glomerulonephritis?
Brown.
No.
Clear.
No.
Dark.
Blood and,
Cloudy.
thank you, 50 points, 25 points, sorry.
Blood and
It's gonna
cloudy.
be cloudy with what was blood in the urine?
Hematuria.
Thank you, extra 5 points over
What'd
here.
you call it?
Hematuria. Hem meaning blood, cloudy, and hematuria. No bonus points. Moving right along. The first 50 patients were surveyed. They were in a renal dialysis unit, and they all reported that their diagnosis was CRF. What does that mean?
Chronic renal failure.
Thank you. You got 50 points. CRF, chronic renal failure. All right, you're playing. After removing all the toxins from the kidneys following dialysis, what lab results would you expect to find increase? What lab results would you expect to be increased?
Your BUN and creatinine? I don't know.
Creatinine, thank
Creatinine?
you. Creatinine would be increased.
Another 100 points.
Another 30 points. Serum creatinine would be increased. All right, anybody, this question for 50 points. What supplement would you give to a patient with CRF? What supplement would you give to a patient with CRF?
Sodium.
Sorry, no.
I hope
No,
not.
no, no.
You know it.
Calcium.
We talked about it earlier. Begins with an F.
Folic acid.
Folic
Thank you. Folic acid. You get it over
It was
there.
you, Harvey Wallbanger.
50 points. Can somebody for 25 points tell me why? Folic acid increases the production of red blood cells. Okay? And it stimulates the erythropoietin hormone in the kidney to manufacture red blood cells. This is an FYI. I just want you to know folic acid. No bonus points there, moving right along. All right, I saved all the pharmacology questions to last.
All right.
3 cards of pharmacology questions. This game is going to a whole new level.
I guess. Game on.
All right.
What?
100 elderly people were surveyed. They said they were having blood